happening as our economies are restarting. And many people are wondering what their own risk might be if they go to a store, to a nail salon, to a party, or to a restaurant. And it's completely normal to be worried and unsure, but also excited all at once. But even though there's still so much we don't know about this virus, there are some things that we do know that can help us assess our own personal risk of getting the virus and of passing it on to our friends and loved ones. We know that this virus likes close talkers, crowded spaces, and contained areas, the 3 C's. So an inside party with lots of people is a setting that poses more risk. To help you assess your risk as you decide what to do and how to do it, we've developed a tool that's available today online at www.canada.ca/coronavirus, our normal website, and it will be linked to our COVID-19 app later this week. Listen, it's not too late or inevitable to see these cases rise. We have the ability to choose our destiny here in Canada. It is in all of our hands. So ask yourself before you go out this weekend, is what I'm about to do worth the risk? Is it worth the risk that I might end up very sick or that someone in my circle will? Listen, Canadians, we've come so far together, and we can continue to protect each other in our new normal. Whenever possible, we have to choose less contact, safer contact, and smaller spaces. Your decisions about your risk affect everyone close to you too. So remember the 3 C's: crowded, contained, and close. And for more guidance, visit and download our risk assessment tool to help you navigate in this new normal. I understand that it's very exciting and we all want to see each other more, but COVID-19 is still here. Let's continue to protect each other. It's in all of our hands. Thank you.
Bonjour à toutes et tous.
Hello, everyone.
Today, it's kind of like my first media briefing after a small break, which was really great to have. I'd like to just first discuss the current epidemiology of COVID-19 in Canada and then revisit what this means in terms of our control measures. So starting with the key numbers, there have been 112,672 cases of COVID-19 in Canada, including 8,874 deaths. 87% of people have now recovered. Labs across Canada have tested over 3,697,000 people for COVID-19 to date, and over the past week, an average of 44,000 people were tested daily, with 1% testing positive. I just want to add a new key number to our routine numbers update, the average daily case count. Thanks to Canadians' sacrifices to bring COVID-19 under control in Canada, jurisdictions across the country have been able to carefully reopen social and economic spaces. But we can't do this safely without closely monitoring for changes in COVID-19 activity. And that means we need to be laser focused on the trend in daily case counts. Because individual case counts can fluctuate from day to day, it helps to look at the average of the daily case counts over the most recent 7 days to see where things are trending. It also makes for better comparison if we want to look back at what was happening with the trend during prior weeks of the epidemic. For example, if we look back to the peak of daily case counts in early May, the average daily case count was close to 1,800. Since then, the lowest average daily case count was 273, reported in early July. However, most recently, we are starting to see the daily case count trend upwards again, with the latest 7-day rolling average at 487 cases being reported daily. Although we know we can't eliminate all cases and clusters of COVID-19, we need to keep on top of things to prevent re-acceleration of growth that could quickly get out of hand. Keeping COVID-19 under control means keeping case and contact numbers as low as possible so that the public health authorities are able to manage the workload of testing and isolating cases and tracing and quarantining contacts. These functions are critical for keeping epidemic growth in check and ultimately for protecting the health system, as well as the functioning of our economy and society. The upward trend in daily case counts is worrisome. We know that we have the means to keep COVID-19 under control, but this is by no means a sure thing. It is going to take all Canadians doing their part and working together with public health to keep the curve down. This includes younger age groups, in particular those aged 20 to 39 years, who account for the highest incidence rates for COVID-19 cases across all the ages during the past 2 weeks. So I must urge all Canadians, particularly younger adults, to not give into COVID-19 fatigue. This is your generation and your future that is being shaped. Younger age groups are not invincible against COVID-19. In fact, over 60% of cases reporting to the Public Health Agency this week were under the age of 39, and almost 1/3 of these younger adults were hospitalized. And it doesn't end there. Recent evidence suggests that fewer than 1% of Canadians have been infected with a virus that causes COVID-19. The Canadian population remains highly susceptible to the virus, and if we let our guard down, the disease will work its way to our parents and grandparents and other vulnerable people who need to be protected through our actions. Now is the chance to be a lifesaver. We all need to take this disease and our responsibility to protect others seriously. We've come too far and we've sacrificed and lost too much, including, most tragically, the lives of over 8,800 Canadians. Let's not go back there. Thank you.
Bonjour. Nous aimerions parler de l'épidémiologie de la COVID-19 au Canada.
We'd like to discuss the current epidemiology of COVID-19 in Canada and revisit what that means for COVID-19 control in Canada. Let's start with the key numbers. There have been 112,672 cases of COVID-19 in Canada, including 8,874 deaths. 87% of people have now recovered. Laboratories across Canada have tested over 3,697,000 people for COVID up to date. Over the past week, an average of 44,000 people were tested daily, with 1% testing positive. Now, we want to add a new key number to our routine numbers update. That is, the average daily case count. Thanks to Canadians' sacrifices to bring COVID-19 under control in Canada, jurisdictions across the country have been able to carefully reopen social and economic spaces. However, we cannot continue to do so safely if we don't closely monitor for changes in COVID-19 activity. That means that we need to be laser-focused on the trend in daily case counts. Why? Because individual daily counts can fluctuate from day to day, so it helps to look at the average of the daily case count over the most recent 7 days to see where things are trending. This also makes for a better comparison if we want to look back at what was happening with trends during prior weeks of the epidemic. For example, if we look back to the peak of daily case counts in early May, the average daily case count was close to 1,800. Since then, the lowest average daily case count was 273, reported in early July. However, most recently, we've started to see the daily case count trend upwards again, with the latest 7-day rolling average at 487 cases reported daily. Although we know we can't eliminate all cases in clusters of COVID-19, we need to keep on top of things to prevent a re-acceleration of growth that could quickly get out of hand. Keeping COVID-19 under control means keeping case and contact numbers as low as possible, so public health authorities are able to manage the workload of testing and isolating cases and manage tracing and quarantining contacts. These functions are crucial for keeping epidemic growth in check. and, ultimately, for protecting the health system as well as the functioning of our economy and society. The upward trend in daily case counts is worrisome. We know that we have the means to keep COVID-19 under control, but this is by no means a sure thing. Each and every single Canadian will have to do his or her part and work together with public health to keep the curve down. And this includes younger age groups, in particular those aged 20 to 39 years who account for the highest incidence rates for COVID-19 cases across all age groups during the past 2 weeks. So I must urge all Canadians, particularly younger adults, to not give in to COVID-19 fatigue. This is your generation and your future that is being shaped. Younger age groups are not invincible to COVID-19. In fact, over 60% of cases reported to the Public Health Agency this week were cases of Canadians under the age of 39. Almost one-third of these young people were hospitalized. And that's not all. Recent evidence suggests that fewer than 1% of Canadians have been infected with the virus that causes COVID-19. The Canadian population remains highly susceptible to the virus, and if we let our guard down, the disease will work its way to our parents and our grandparents and other vulnerable Canadians who need to be protected, who we need to protect through our actions. Now is the chance to save lives. We all need to take this disease and our responsibility to protect each other seriously. We have come too far. We have sacrificed and lost too much, including, most tragically, the lives of over 8,800 Canadians. That is a tragedy. Let's not get back to that place. Thank you.
I want to acknowledge that we are on the unceded territories of the Algonquin people. As of July 23rd, in First Nations communities in the provinces, there have been 368 confirmed cases reported, a rate of infection that's 3 times lower than that of the general Canadian population. And of those, 337 have recovered, a recovery rate of 92%. Sadly, 6 lives have been lost to COVID on reserve, a case fatality rate of 1.6%, a rate that's 4 times lower than that of the general Canadian population. Merci. With that, I'm going to turn it over to Alex.
Thank you, Doctor, and thank you, Minister. We'll go for questions. It's just a standard 1 question, 1 follow-up, and we'll begin on the phone. Operator, over to you.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while the participants register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. And our first question, notre prochaine question est de Mike Blanchfield from the Canadian Press. Please go ahead. La parole est à vous.
Yes, I have a question about mRNA vaccine technology. It's for the minister and also for our doctors as well, if they want to weigh in on a scientific point of view. The U.S. has funded more than $2 billion spent more than $2 billion funding companies who are working on this on vaccines based on this mRNA technology. There are proposals, at least one that I know of, in front of the Canadian government that have been sitting gathering dust for at least 2 months. Why is the government taking so long to consider spending money for a vaccine with this new technology to at least find out if it's a viable solution to this pandemic? And that's for the minister, and if the doctors want to weigh in on why they think this technology may or may not be worth funding.
Well, maybe I can start. Is that okay with you, Minister? Oh, you
Minister,
might have been on mute.
Well.
I'm not sure.
Sorry, I think I was on mute. Let me start, and then I'll turn it over to Dr. Tam. I'd like to reject the premise of the question that we have applications sitting around gathering dust. In fact, I want to thank the Immunity Task Force and the Vaccine Task Force in particular, which has been working diligently with the federal government to make sure that the technologies and the vaccine candidates that we choose to put our money on actually are the ones that are going to be the most promising and the most effective.
Sorry, we've just got... Sorry, Minister, you froze there for a second. If you can go back just a moment.
Sure. Northern Ontario, you gotta love it. Listen, we've got to be very thankful that we have such an incredible group of professionals that are on the vaccine task force, providing really good advice to the Canadian government on where we should put our money in terms of investing in promising vaccines. And I will turn to the doctors to speak a little bit more about the technology.
Just to add that, I think from our approach, and fundamentally the Vaccine Task Force is doing incredible work in examining all international candidates as well as some of the domestic candidates. As you probably have heard, there's certainly, the last time I looked was over 120 kind of vaccine candidates in development, and some of which have began sort of at least some of the starts to the clinical trials. So we've been keeping abreast of all of that data as it becomes available. And so I think that we're going to have a very varied and comprehensive response, not necessarily looking at one specific candidate, but looking at all viable candidates. And the task force is helping the Government of Canada do that. So we're not ruling out any of these candidates. The mRNA vaccine technology is a newer, more experimental technology, but completely worthy of being part of the actual analysis which is being undertaken and will be considered as part of the investment portfolio.
Thank you, Doctor. Follow-up, Mike?
Just for the record, Minister, it's not a false premise because I've got the documents and government emails to prove that's not the case. But my follow-up is for Dr. Tam. If mRNA is viable and perhaps part of the equation, do you not think it might be? How do you balance moving quickly and getting some work done and perhaps trying to move ahead with some funding as the Americans have versus trying to be prudent as you're trying to do?
No, I think you have a very good point, and the approach isn't to just wait until we got, absolutely every piece of data. I think the Canadian approach is also to be ahead of the curve as well. So I'm sure there'll be more information to come in the near future on that. The mRNA technology, of which there are many different candidates, but some of the front runner is mRNA vaccines. They are more in the sort of experimental sphere, but some of them have undergone the initial clinical trials, phase 1 and 2 studies, aiming to begin the phase 3. And so the regulatory authority, Health Canada, and the experts of the Vaccine Task Force have examined all of this data. So again, we're not discounting this, and this is a sort of accelerated approach, not just on the regulatory and clinical trial front, but also an accelerated approach on looking at investments as well.
Thank you. Operator, next question, please.
Thank you. The next question, la prochaine question est de Émilie Bergeron de l'agence QMI.
Next question, Émilie Bergeron from Agence QMI. Go ahead.
My first question is for Minister Aidu about the contact tracing app. We know that there's been some delays about the launching that was previously announced about the recommended app. Do you have an update for us on like how is this file going on and about which provinces are ready to roll it out? Especially, we know that some provinces want to make consultations before. So, what is the information or the updates you have on your part at this point?
Merci pour la question, and I'm excited about the potential of the notification app. I think we should be really clear that it's not about contact tracing exactly, but rather notifying people who have the app downloaded on their phone if they've been in close contact with someone who eventually becomes diagnosed with COVID-19. And I think it'll be an additional tool that will be useful to Canadians to help them assess their risk and their exposure. So the app right now is in beta testing. It is being tested with a variety of users to make sure we truly understand we're putting the final touches, I guess, on the app to make sure that we understand if there are any challenges to user functionality, if there are blind spots, I suppose, in the design of the app that makes it less appealing to use, and those should be concluded very shortly. I'm really looking forward to having something to say about the app in the very near future.
Emily?
Follow-up question.
Yes,
thank you.
Thanks very much for the update about that. And I want to know on another topic about the We Charity file and affair, if I may say so. It is stated in the public records that the Public Health Agency paid a contract to We Charity. I think it's about $25,000 in October 2019. So what do you know about that contract that you can tell us today that you have the information right now? Maybe you are already asked questions. So and if I can add also, because I don't think you commented publicly, are you still confident about Minister Morneau as a finance minister on this file too?
Okay, thanks. I think technically that counts as two questions, but they're a little bit related, so I'll answer them both. In terms of the Public Health Agency of Canada's contract with We Charity, it precedes my time, but I understand that it was to engage We in the work that they do, engaging youth around health-related issues. Certainly, we can get you details on that contract at a later date, but just suffice to say the Public Health Agency of Canada regularly works with community-based partners, not-for-profit organizations to further disseminate health information to a variety of different parts of the Canadian population. In terms of my confidence in Minister Morneau, I'll just say that I have always enjoyed working with Minister Morneau. I have confidence in him as a finance minister. He has been a key player. He has had a key role actually in Canada's response to COVID-19. I credit him with very early actions from a fiscal perspective to support Canadians to stay at home. For example, the launch of the CERB, the support that he's been able to put together with colleagues around the table around small business supports and ensuring that our economy has the strength to survive what I would say is a challenge of a generation has been truly admirable. And I've worked with him prior to this, of course, as a cabinet minister with my other portfolios, and have always found him to be a very reasonable and a very thoughtful colleague. So he has my support, of course.
Thank you. We'll now turn to the room for two questions and then go back to the phone. Over to you, Mackenzie.
Hi, Mackenzie Gray from CTV News. My first question is for Ms. Haidu. Following up on the previous question about you referenced that you still have confidence in the finance minister and you've worked with him previously on these issues, but this is not the first time the finance minister has had ethical concerns raised with him. He was found guilty by the ethics commissioner previously for other transgressions. There's now an investigation into his current dealings with this. Should there not be consequences for Minister Morneau, who has repeatedly had ethical issues with his involvement in the finance file?
Well, thank you for the question. Listen, I think consequences for infractions of any kind of guideline is really at the, it's the responsibility of the office holder to determine what consequences are appropriate. It wouldn't be appropriate for me to determine whether or not consequences are appropriate. The Office of the Ethics Commissioner the Ethics Commissioner himself will do the work that is necessary and determine for himself what next steps need to be taken.
My second question is for Dr. Tam, for Dr. New. Nice to see you back, Dr. Tam. Hope you had a nice vacation. We've obviously seen a large uptick with youth across the country. You seem to be quite concerned about that in your opening statements. What do youth need to do to make sure that the uptick comes forward? And specifically for you, Dr. Tam, because we've asked Dr. New about this a number of times while you were off. We've seen that bars and restaurants are reopening. We're looking to see if that's going to be an issue going forward here in Canada. But we've already seen in the U.S. that was a major concern in Florida and in other states where we've seen reopenings go forward. Why would we consider reopening bars and restaurants when we've seen in the U.S. when that happens, there is a direct correlation with an increase in COVID cases?
Yes, so a lot of these decisions, of course, done at the sort of local level, but it is a topic of ongoing monitoring and discussion with all the chief medical officers of health in the province and territories. As we reopen society, and no matter what setting, we know that certain characteristics of settings are at higher risk. So if it's sort of an indoor dining and maybe bar setting where people are crowded and they're not observing the guidance, that is a massive concern. I do believe that my colleagues are keeping a very close eye on this, because what we, as a public health approach, is that if you can immediately clamp down and detect cases, rapidly test them and clamp down on them and be able to manage them, that's one approach. But it's awfully hard for public health if the public is engaging in a lot of contacts and you have a hard time doing the contact tracing. That is going to be really tough. And they will be adjusting, as you have seen in British Columbia and other places, adapting to their local approaches on what to do about bars and restaurants. But absolutely guarantee that they're totally focused on exactly what's happening there and see how they can retool their public health guidance or compliance or other measures. But I would suggest that you can also talk to some of the local medical officers of health.
Hi, Ashley Brooks.
But, for the youth, I think the first part of your question, yeah, it is. We do need to do better in how to reach a younger population. Of course, the first part of the pandemic was devastating on older populations, seniors, and vulnerable populations. But the younger age group needs different messaging. I think better engagement with them through different channels. So some of the communication strategies, I think, needs to evolve given the population that we're talking about, and that we can reach them better. But I think the key message is that, as we've seen, this population can get infected and they can transmit amongst each other. We're watching very carefully on some of the early signals as to whether that then is leading to increased hospitalizations, and I've just mentioned some of those earlier signals in Alberta. And also, is it going to impact the most vulnerable? And that is not what we want to see. So I think for the younger adults, please observe the public health measures, because then that will assure we can still go about some of the social and economic activities in a safer way. And I think that's the objective.
And can I add something? I just like to remind the young people who are potentially listening, or their parents who may speak to them after, about a key figure in Dr. Tam's presentation, which is that a third of the people in this young age group ended up hospitalized. That's not a small number. That's a large number. And I think even though we know that the older a person is, the more the higher likelihood that they'll have an extremely adverse outcome with COVID-19. That number of a third of these young people being hospitalized should hopefully be a good, stark reminder to young people across the country that even though we know that young people are dying less frequently, that there are still significant health outcomes if you are a person that has a more severe experience with COVID-19. So it's really important that young people understand that they are not bulletproof, as much as we might feel that way when we're in our 20s and 30s.
Hi, Ashley Burke, CBC News. Minister Hajdu, you have been outspoken about harassment in the workplace, especially in federally regulated ones, and have pushed for legislation to put in place harassment policies. What's your reaction to hear that Rideau Hall, which is federally regulated, there are claims from 16 people that there was a toxic environment there coming from the top, coming from the Governor General and our Secretary, involving belittling and humiliating employees, putting them down to the point where people are reduced to tears, and some of them have left altogether?
Well, thank you very much. And you're absolutely right. As the Minister of Employment, one of my jobs was to create harassment and workplace violence legislation, which passed, as you know, in our last mandate, and historically, for the very first time, protects political staff, which would include members of Rideau Hall. These stories are extremely saddening, and I think, obviously, that a full investigation needs to be conducted, and these employees do have rights, and they have legislation that protects them as a result of the work of our government, and me in particular as a Minister of Employment. I want to thank all my colleagues who worked so diligently on getting that legislation through, because of course it'll be a useful tool as that investigation unfolds. But everybody has the right to work in a place that is free of harassment and violence, full stop, regardless of what the setting.
The Privy Council's office is going to be conducting this external review, and some former employees say, look, it's not going to be legitimate unless we are interviewed. Who do you want to see involved in the review? Should former employees be part of it? And as well, what other parameters should be set in terms of protecting their identity so this doesn't come back, since the allegations are coming from the very top?
Well, thank you. And I don't know the full extent of what the Privy Council has planned for the review. I will just say that it's very important that anyone who has experienced harassment in the workplace in that setting or any other setting needs to be fully able to tell their story and to weigh in on their experience. And I will leave it in the hands of the Privy Council office in terms of how that's conducted. Oftentimes it is a bit of an avalanche when, one or two people come forward. In fact, sometimes other stories are unearthed. It can be extremely frightening to come forward when you're the victim of harassment or workplace violence. As you know, as many people know, for victims of harassment in the workplace, it is intertwined with our ability to make a living, and it is a very scary thing sometimes to come forward. So sometimes when the silence is broken, other people have stories, and that will be for the investigators to unpack.
Thank you. We'll now return to the phones for two more questions. Operator.
Certainly. The next question, la prochaine question est de Louis Blouin de Radio-Canada.
Next question, Louis Blouin, Radio-Canada. Question.
Blouin here. On the WE controversy, your colleague Pablo Rodriguez said publicly today that he thinks changes are needed, more safeguards around the Minister of Finance and the Prime Minister so that potential conflicts of interest are flagged more repeatedly. Do you share his point of view? Do you think that some changes are needed?
I think that listen, I'm open to any changes that make it easier for people to identify when they have a conflict. Sometimes it is challenging to understand if we have a conflict of interest. We do have an office of the Ethics Commissioner, which we can all reach out to on a regular basis to determine if there's a conflict. But sometimes they are not as easy to see as someone might anticipate. And so I'm always open to ideas and suggestions that would make it more of a routine check, for example, for ministers as they make decisions. So I look forward to hearing what those suggestions might be.
The Conservative leader is now asking for the PM to step down, saying this controversy is a distraction in the management of the sanitary crisis. Are you worried that the Prime Minister and the Minister of Finance are too busy right now managing a political crisis instead of putting all their efforts on the pandemic impacts? Are you worried about that?
Listen, I have had regular and ongoing conversations with both the finance minister and the prime minister and continue to do so on the issue of COVID-19 and other related health file matters. They are both professionals, and I believe they can, so as the saying goes, chew gum and walk at the same time. I am certain and confident that their attention is focused on this particular stage of COVID-19 and the many other challenges that Canadians are facing. And quite frankly, that's where my attention is as well.
Merci. Prochaine question. Operator.
The next question, la prochaine question est de Beatrice Britness from Global News. Please go ahead. Your line is open.
Hi, my first question is for Minister Hajdu. The government hasn't really specified why the contact tracing app or the rollout of the national contact tracing app has been delayed. It was supposed to begin testing or the pilot in Ontario on July 2nd. So what's the reason for the delay with Canada's contact tracing app, and why has it only started beta testing 3 weeks after it was supposed to pilot in Ontario?
Well, thanks for the question. Actually, I have answered that question recently, but I'll answer it again. In fact, what we wanted to make sure was that the launch of the app was as close to, I would say, and I'm scared to say the word perfect, but as close to perfect as possible, so that when people downloaded the app, they would not be deterred by any kind of glitches or problems with the app in the early days. We know from user science, user behavior, that when people download an app that doesn't work, they often abandon the app, and the success to this app is actually a large portion of Canadians using it. And so it was worth the time and extra energy to make sure that the app that we unveiled was tested and thoroughly debugged to make sure that it would be a pleasant user experience. Secondly, we worked very closely with the Office of the Privacy Commissioner to make sure we understood any concerns of the Privacy Commissioner, and we're fully cognizant of how best to protect Canadians' privacy. We know that is of paramount importance to Canadians. And so those pieces of work deserved the time to get it right, and that's exactly what we did.
Follow-up, Beatrice?
Thanks. And I'm wondering if you could provide any further details on when you're tracking to roll out in Ontario now and nationally afterward, or if that's still the plan.
The plan and the hope is that this will be a national app that all Canadians can use. We know that Ontario is ready to go as sort of the pilot province, and we hope to have that app out as soon as possible. I know that we're very close now.
Thank you, and we'll take one more question.
Dr. New, my last question's for you. Yesterday, the big news out of the States was Dr. Fauci. He threw the opening pitch out at the Washington Nationals game, and he missed the ball, getting to play quite quickly. If you threw the ball out at the Jays game, would you confirm to Canadians that you'd be able to get it over the plate? And would you be open to doing something like that?
Thank you for the question. Unfortunately, this season it's not a possibility because the Blue Jays won't be playing on Canadian soil, but certainly hopefully being optimistic, if the 2021 season unfolds and the Blue Jays are able to have a hope opener on Canadian soil, and they do invite me, I would certainly consider it. With respect to getting the ball to home plate, I can appreciate it's not that easy, like 60 feet 6 inches or 20 meters in sort of the metric system here in Canada. Especially with a full stadium, can be daunting. I commend Dr. Fauci for what he did. I think it took a lot of, courage to do that on national TV, and I think he probably had a little bit, maybe too much adrenaline going. But I think he's taking it all in good stride, good humor, and I could hopefully maybe keep my adrenaline check if I do get that opportunity in the future. So thank you for the question.
If I did that, it would go backwards.
Thank you. That commences that finishes our press conference for today. Thank you.
You watched it live here on CBC News Network, an update on Canada's response to COVID-19. We do know there is a contact tracing app being tested right now, although Minister Patty Hajdu, the health minister, declined to call it that, calling it more of a notification app, but says she's excited about making another announcement in the very near future. So perhaps there will be, once that passes testing, it will be spread out across Ontario and then the rest of the country. Also asked about her confidence in Bill Morneau, the finance minister. As you know, that whole We controversy, the We charity organization. She says, yes, she has full confidence in him. And also a question about the alleged toxic environment in the office of the Governor General. And Patty Hajdu saying that the stories are saddening. That was a story CBC broke, by the way, and she is in favor of a full investigation. And that is underway. There is lots more still to come right here on CBC News Network. I'm Suhana Marchand. We are back in just a moment.